Herkese merhabalar.
Hi everyone. There is one issue that shocks some patients. Let's say we receive a patient who has undergone surgery somewhere else. He is not satisfied with the results and has complaints. He wants to undergo a revision surgery. However, he gets shocked when he hears the price. Let me tell you, friends, the cost of a revision surgery is approximately 3 times that of a regular operation. Why is that so? Revision surgery is always more expensive than regular surgery. The surgeon has to correct the unfavorable results of a poorly performed surgery. So, you not only take on someone else's sin or responsibility, but you also have to assume the responsibility of correcting something that has been poorly performed. When a new patient comes to us directly, we help him the best we can. But the situation of a revision patient is worse than it should be in the first place. So the patient has become worse, and we are required first to restore the patient to his previous state and then eliminate his problem. So the distance we have to travel is twice. Revision surgeries are always more challenging. The patient is already disappointed, that is, dissatisfied with prior results. He wants those poor results to be corrected. He further requests an inexpensive surgery. Well, patients demand everything at the same time. He may demand the correction of poor results for free. Well, that's not how things work. Revision surgeries are always more expensive. It may be twice or 3 times the cost of a regular surgery. I recently experienced something of the sort. Our colleague's patients started coming to me after surgeries. Well, I called him. I told him that patients from his clinic visited me with various complications. I told him that he had to correct some technical issues. I simply wanted to inform him that I was performing revision surgeries on his previous patients at 3 times the price. His reaction was, "So, you're turning my patients against me and charging 3 times the price?" I said, "Sorry bro, but I don't run a charity here. Have I promised to undertake your revision surgeries at low cost? Is this possible? I'm neither the Social Security Administration, I'm not a charity organization. Revision surgery is always more expensive because the work you have to do is twice as much. In addition, you have to assume the responsibility for a problem created by someone else. So no one can do it for a lower price, nor for free." Well, patients ask me, why revision surgery is so expensive? Now you know the reason. I will send this video to patients asking me this question. Revision surgery is always expensive, no need to argue. The patient who cannot afford it will have to go back to his first surgeon. Let me also say, well, if you have a problem, the first person you should be contacting is your own surgeon. I've been saying it over the years. You can check my old videos or my website articles. Did you encounter a problem? The person who has the best opinion about your problem and can make the correction is your own surgeon. So I suggest you to go back to your first surgeon. He will best know the procedures undertaken. But sometimes I get messages from patients. I've undergone a surgery on this date. I've had these problems. Well, Professor, could you correct this? What do you think should be done? Will I be okay? How should I know whether it can be resolved? How can I know? Well, there are many things I don't know. I have not seen the patient before. I have not seen the operation area. I don't know anything about pre-surgery. I do not know which procedures were applied during surgery. How can I know whether the surgeon did something ridiculous? Maybe he didn't apply a well-known approved technique. I didn't follow up the post-operative process, so there are thousands of unknowns. It's like an equation with 8 variables. Can we get a result on that basis? No. So I just don't know. Sometimes I answer the patient saying, "How should I know?" The reply is, "You act like that because you didn't perform the surgery, right?" Come on, please be reasonable. How can I give an answer about something that I don't know? If the patient comes to me for examination, if I check his problem, if I have the opportunity to see the flexibility and anatomy of the tissues, then I might give an answer as to how much it can improve. Then I can figure out the cost of the operation. So, in other words, I can only answer these questions after examining the patient. But they will still remain unknown. I don't know the pre-surgery condition. I don't know which procedures were applied during surgery. Subcutaneous procedures may have taken place. But then patients start frowning at me. Well, the first person you should see is your own surgeon. In case your own surgeon cannot provide any relief, then you may start contacting other surgeons. But as I've said before, the cost will be high. Okay? So, let me make one thing clear. Unfortunately, some colleagues don't show adequate concern for their patients. The patient is followed by an assistant or a nurse in the post-surgical period and never sees the surgeon. They say, the surgeon does not have a cell phone, or they might refuse to share his number. Well, you should take precautions from the beginning. Are you going to have a surgery? The first thing you should do is, please make a note of this. The first thing you should do is to get the surgeon's phone number. We have mobile communication technology. It is now possible to reach someone directly. This technology ensures that. Say you have an accident in a remote place, you can call an ambulance, right? When you encounter post-surgical problems, you should likewise call your surgeon directly. What good is that technology if you're not going to use it for that purpose? Just to watch TikTok videos? Cell phones exist for a reason. If you will undergo a surgery, get your surgeon's phone number in advance. Then you won't get an answer like, the surgeon does not have a cell phone when you call the clinic after suffering from a post-surgical problem. Okay? In fact, it is even ridiculous to talk about this. Patients should do this right away. Sometimes patients find themselves in complicated situations. It was years ago, a female patient called me from a different city. She told me that she underwent a liposuction, but she could not visit her surgeon for a check. Well, I won't go into much detail. It's not a pleasant topic. But in short, the surgeon did not call her back for a check. They had a problem somewhere, and the patient wanted my opinion as to what she could do. I said, well, I can't help you with that. I suggested her to see another plastic surgeon. So, if your communication with your own surgeon has broken down due to such a problem, then your only remedy is to see another surgeon. Sorry, but there is no other way. Sometimes I really can't help. Well, therefore, the cost of revision surgery is a non-negotiable issue. Some ask me why, some demand a discount, some offer other suggestions. Well, this issue is not up for discussion. If a patient is not originally my patient, and in case he cannot get a remedy from his first surgeon and demands a solution from another surgeon, he has to bear the cost. This is the situation. Well, it was an unpleasant subject, I agree, but I had to explain it. So we have made it clear in this video. Well, hope to see you next time.